There is a significant population of Portuguese-speaking residents in Lambeth. So for example, in my practice here, 30% of our registered patients are Portuguese-speaking. And with that, what we see are health inequalities that are linked to language, culture, and socioeconomic status. We see that play out. So prevalence of long-term conditions, risk factors to long-term conditions, and access to health are poor in that community. And so over the last 6 or 7 years, what we've been doing here in Lambeth is creating a network of organisations on the ground to sort of come together across both statutory and third sector organisations to create new ways of working with that community. The theory of social determinants tells us that when we support people, we should be doing it in a holistic way. In reality, we're often limited by our own expertise and the questions we ask in our assessments. And what the household model is doing is challenging that. And we do that by not defining people by a disease or a need, but actually asking questions initially about their environment and their close social contacts. And our hope is that actually if we can improve the wellbeing capacity within that household unit, then that has positive impacts on all the individuals in that household, not just now, but in the future as well. Initially in our first phase, what we've done is we worked with 15 households in North Lambeth. And what we've really been trying to figure out is questions around how you define a household, what does the team look like as far as creating the members of the community to come together and deliver this, what sort of questions and interventions you provide for the household. And we've had some amazing qualitative feedback from the households and really helped move forward. We're pretty confident at where we are now. However, what we want to do next is really understand how what we're doing impacts system resource and improve health metrics. And also really importantly, how we can transfer what we're doing to other communities, other cohorts, other residents. And so that's quite an exciting phase we're in at the moment. I think one of the biggest learnings for me through this has been the value in sort of genuinely letting go and sharing that power around how you assess health and well-being for a cohort of people. It can be extremely unnerving and a bit uncomfortable initially, but actually if you stick with it, then long term there's some really fruitful outcomes.